Hi, I'm Sherry Torkis. I'm a pharmacist and author here from Canada, participating in the Palm Oil Nutrition Week. And I'm here with the opportunity to interview Dr. Khosla on his amazing research and presentations that he's been doing here at Palm Week International, really highlighting how our thought processes have changed and understanding of the impact of saturated fat with respect to heart disease. I talk to a lot of people through my work as a pharmacist and in the media that still have this perception that saturated fat equals heart disease. So I was really excited to hear about your research and the way you were able to put things together to show the perspective that saturated fat is really not the enemy that we once thought it was, that there are different types of saturated fats, and that saturated fat does not necessarily mean increased risk of heart disease. Can you just share with us some of your comments with respect to how our thinking has evolved over the years, and what advice would you give people that are looking to reduce the risk of heart disease through dietary interventions?
Okay, so I think the first point is that with relation to saturated fat, we've focused on saturated fat for 50 years. And perhaps the time has come that the emphasis needs to shift. Because if you look at saturated fat simply beyond cholesterol, beyond what it does to LDL and HDL, if you actually look at endpoints of heart disease, if you look at deaths from heart disease, cardiovascular mortality, the last 3-4 years there have been some very compelling studies which are saying that association may not be there, or it may be weak. So it's sort of like a risk analysis you do, in the diet, what is there that's going to have a huge impact? Turns out saturated fat may not be something that has that, such a high impact. Obviously, we know in terms of lifestyle, stopping smoking, that's a major. You do that, forget about everything else. So similarly, in terms of the diet now, maybe saturated fat is not something that we should pay attention to. We definitely need to avoid trans fat, because the data on that is, again, clear, whether you look at endpoints, you look at biomarkers, yes, partially hydrogenated vegetable oils containing trans fatty acids, they're a problem. Now, of course, we have legislation both in the US, Canada, where we're trying to reformulate the food supply and get rid of trans. So that's a positive step, but the consumer can still stay focused and make sure they avoid those. Next big thing in terms of diet is refined carbohydrates, which is something we have not paid much attention to. And refined carbohydrate does impact cholesterol, so it does impact heart disease.
And I think a lot of people are surprised, and I know when I was researching Saving Women's Hearts, which is a book that I wrote recently, I did talk about the research showing that a diet high in refined carbohydrates, high glycemic diet, actually can increase the risk of heart disease more so than a diet high in saturated fat. I think we really need to get that message out there, because I think there is a lot of misconceptions. People think fat is bad and they eat more carbs and they're going to end up with more problems.
That's absolutely correct, and that's exactly what the data is showing. And in fact, just anecdotally, just look at the evidence over the last 30 years. We've been telling people to cut down fat, cut down saturated fat, and yet we have more obesity.
More obesity, more heart disease.
More heart disease, exactly. So it's not that saturated fat is benign, it does nothing. Maybe the focus is completely different. We need to shift focus on something else.
Well, thank you so much for your time. I appreciate the opportunity to speak to you and to participate in this conference. Thanks again.
Thank you so much.